Okay, we now have the windows here at the intercostal spaces, right? The windows were made close to the sternum. These vessels that you can see, these are the internal thoracic vessels, no? Artery and its accompanying vein. On the next intercostal space level, you have the same distal continuation of the vessels. The artery, by the way, comes from the subclavian. No? So the internal thoracic, no, artery will it's the origin for the anterior intercostal arteries, while your internal thoracic vein, no, it's where the anterior intercostal veins will drain. So together with these vessels, there's actually a third vessel that runs alongside the artery and the vein. And those are the lymphatic vessels. No? You have lymphatic vessels running alongside the internal thoracic vessels. So these lymph vessels, there are lymph nodes that are strategically distributed along their length. So they drain lymph coming from the soft tissues of the anterior chest wall close to the sternum. Then the lymph vessels have connection to the lymph network on the other side. So when you have malignant breast tumors with lymph node spread, there is really that chance that the tumor can metastasize and reach the other side. Excuse me. So the anterior intercostal artery and vein, they are particularly prominent or big in ladies, no? Because they serve as part of the blood supply and venous drainage to the breast. And in males, obviously, they are not particularly prominent because males have breast tissue which is not well developed, no? Rudimentary. No? Males have rudimentary breast tissue. But if males are given hormones, no? Male breast tissue can be stimulated to develop and grow, like what you can see in some of our transvestites. No? They take female hormones and they experience breast enlargement. So let's go here to the area where we have the thoracoacromial trunk. What are visible right now? No? You can see very large vein here. That's the axillary vein. No? So the axillary vein drains into the subclavian vein. The boundary for axillary and subclavian vessel, no, would be the inferior margin of the first rib. So the axillary artery is not very visible at this point in time, but you can see this artery right here, no? This blood vessel. So this artery is actually the thoracoacromial trunk. Can you see that one? So that's the thoracoacromial trunk. No? It will have branches that will supply the muscles and other soft tissue structures of the anterior chest wall. So its origin, no? Not completely exposed, but you can see, no? The origin of the thoracoacromial trunk is the axillary artery, and Very small part of that axillary artery can be seen at the tip of the mosquito forceps right there. You can see branches going to the pectoralis major, then you even have branch going to the shoulder area, no? Deltopectoral. So it will have a branch going to the deltoid muscle. So this one again is the pectoralis minor, the nerve passing right above the superior border of the muscle is the lateral pectoral nerve. Then these nerve branches piercing the muscle, they come from the medial pectoral nerve. So other things that we can discuss, levels of axillary lymph nodes. So axillary lymph nodes are clinically important, especially in breast cancer, because they act as the sentinel nodes, no? Or they are the first chain of lymph nodes where breast tumors can metastasize. So they are grouped into 3 levels, no? So all lymph nodes below or lateral to the pectoralis minor muscle, they are called the level 1 lymph nodes. So all lymph nodes above or medial to the muscle. So we say this part is above or medial to, because your pectoralis minor is obliquely positioned like that, no? So this part is above and medial to the muscle. So level 3 nodes. Level 2 nodes are found, no, right beneath the muscle. So for this particular cadaver, male cadaver, he has no functional breast tissue, and I guess he has no breast tumor or breast cancer. So the lymph nodes are not really visible and identifiable for this particular cadaver. But if you have cadavers, no, or in actual surgical patients where you have lymph node malignancy, lymphoma, or for breast cancer patients, no, with nodal spread of the tumor, the lymph nodes are when the lymph nodes are enlarged, they are really visible, no? But for lymph nodes that are not non-pathologic, no, they are very small. To give you a size comparison, maybe they're as big or they're the same size or smaller than the green mongo beans.